Hello and welcome to our COVID chat. This is NorthBay's way to reach out to you with information and the latest updates on COVID. And with us is Chief Medical Officer Seth Kaufman. Take it away, Dr. Kaufman.
Hey, thanks, Robin. Good morning, everyone. It's cold and rainy out there. Feels like winter, which I love. As usual in these sessions, I'll start with some of the hot topics, and you can guess what the first one's going to be. And then we'll go right into your questions, and we'll go from there. I'll just start as the first hot topic, talk about Omicron. But before that, I think you should understand where rates are right now in Solano County and here at NorthBay. Rates remain, both case rates and hospitalizations remain very low. Hospitalizations across the county are in the 20s, the low 20s. That's very low, not the lowest, but that's fairly low historically when we look at the entire pandemic. And case rates, as in new cases every day, has been trending just slightly upward. It's in the 40s. That's still very low. It's a 7-day average. And so that's all very encouraging so far. We are not far enough out from the Thanksgiving period to know whether that's going to have a significant impact or not. That doesn't really say anything about whether Omicron is here or not here, and that'll be our second topic. But rates today are on the lower side. If you asked me why I think today's rates are on the lower side for now, I would say it goes back to the basic stuff that we've talked about in these discussions and you read about every day. Good preventative behavior with mask wearing, distancing, hand hygiene, kind of careful activities. Are you outside when you're having those interactions? And then, camera move there, sorry everyone. And then the vaccine, including the booster, as we'll get into. Omicron is the next topic, and we already know there's going to be some questions around that, so I'm going to save it for the questions. But in short, I'm happy to talk as much as we need to around what we know about Omicron. There's still so many unknowns. And I'll just say when it comes to Omicron, as of this morning, I'm not aware of a case in Solano County. There are about, it could be a little higher now, it's so hard to keep up with the headlines, about 10 cases in California, about 50 cases in the US, and about 1,400 cases worldwide. And that number is going to change on a regular basis. Those numbers are really, really low, but we're just the beginning of this. And so I'll get into Omicron with your questions, I think, instead of as a hot topic. Lastly, one of the hot topics is antiviral therapy. I think over and over again, what we've wanted in the healthcare field and what we want as a community is some sort of oral medication for treatment of COVID. There have been trials for many medications that we already have that have not been shown to be beneficial. And now we have these new antivirals, the Merck medication, and now Pfizer has a candidate also. There's other ones out there. Right now it's kind of I would say we should just hold and let the FDA continue with their independent analysis. I've said it on this discussion before, you can't beat an independent analysis. Pharmaceutical companies doing their industry studies are one thing. I think they do a very good job, but there's inherently going to be sometimes some bias in there. You need that independent study. That's what we do in healthcare. When physicians look at essentially the disclaimers, the conflicts, who is running. When they look at studies, they're looking at the small print and saying, where was the study done? Who were the principal investigators? Was it sponsored by anyone that possibly could have a conflict of interest in that study? So I would say the same goes with these antiviral medications. For the Merck antiviral pill, it's hard to pronounce, but it's like Lopinavir. It was initially shown by Merck to have a 50% reduction in hospitalizations. But when the FDA advisory committee reviewed it, it was 30%. And then they narrowly approved it, and now we wait for actual FDA approval. It's not available yet to us. The UK is rolling it out. These are very promising medications, but we have to weigh out the risk and the benefit. I'm not exactly sure where this will go, but what I foresee is it absolutely won't be indicated to anyone trying to get pregnant. And it will probably be to give it the best benefit will be probably indicated for a very narrow group, for those at high risk, kind of vulnerable for severe disease, especially if unvaccinated. The vaccine still is your best option, the best option. Pfizer is showing a little more benefit. I think we'll see what the FDA, I really have no opinion. I think we'll see what the FDA says. I want a pill like anyone else. For the other treatments, they really are about the same, with the exception of whether the monoclonal antibody, which has a very good benefit against Delta, will have the same against Omicron. Unlikely, but I think those companies will be modifying, updating that medicine, the Regeneron and the others, so that they are beneficial. They are beneficial. Those are my hot topics, Robin. Let's go right into the questions. I know we've received already questions around Omicron.
So yeah, let's get right into the Omicron. Why is there so much concern about this? And do we know how effective our current vaccines are against it?
I've never seen so many headlines, and I've been through the pandemic with you. I've never seen so many headlines about a new variant, and some of it makes sense, and some of it is the same information we got 2 days ago, or 4 days ago, or 6 days ago. And I know we all feel that if you're reading the headlines and you start reading the article, you're saying, you may ask yourself, I don't see a lot of new information in here. It's so hard because we all want it. We all want that information. We also want it to be beneficial. We want to learn it has mild illness. We want to learn the vaccine's effective against it. Maybe we want to learn that it's not as competitive as we it's less competitive against Delta than we thought. And I think all three of those questions today, even with the articles this morning about the vaccine booster being effective against it, are all they're either in vitro studies, very small lab-based studies, or still are theoretical and speculative. We need another week or two. So why is Omicron such a concern? Why did it get much more press than Mu did? And a lot of other variants, right, that are closely monitored by California, which is a very robust sequencing program, and across the world. It's the amount of mutations. It's the most amount of mutations of any variant that we have tracked of concern, a variant of concern. And 30 plus of those, about 35 of those mutations are on the spike protein, where the vaccine essentially is effective against. So that's where, so the theoretical concerns, and I think the initial data is the vaccine for sure is not going to be as effective. You should know with other variants, the alpha variant, for instance, also had a lot of mutations, some mutations on the spike protein, and there was theoretical concerns the vaccine wouldn't be as effective, and it was. Now, this is another level up. There's a lot of differences with that spike protein now because in this new variant, it's hard to believe it would be even close to as efficacious, but there is, historically we know that with the pattern of mutations, the vaccine will work to some degree. The question is just how much. And so far it looks like, and then the amount is helpful. If it's only partially effective, but we really boost our immune systems, it could really be more effective. That's why you're getting all those, all that communication to supporting getting the booster. I've had my booster. You should get your booster. There's no reason not to, in my opinion. If you're 6 months from your mRNA vaccine or 2 months from your Johnson & Johnson vaccine, you've had it. It was safe when you got it. You should get a booster. And I do think that data will continue to show that it's partially effective against Omicron, and that a booster helps. I think the initial data showing that, we need another week or two, but I think it'll be effective. Does it cause milder disease? It's really hard to know today. This is the most coordinated worldwide effort I've seen in this pandemic to try to quickly identify and organize around a variant, and it's wonderful. That's a great thing. That's what we want. But still, today, maybe in an hour there'll be an article and stuff, but today, so far, there hasn't been enough systematic efforts to really try to organize the symptoms and understand whether it causes mild or severe disease. Part of that is we need more cases. Part of that is enough time hasn't gone by. It takes 2 weeks to start seeing some of the hospitalizations and severe illness. That's part of the difficulty with this disease. It's a very long process from first being sick to getting very, very sick. In the ER where I work, we get nervous when we see somebody come in sick and it's been day 10, 11, or 12 since they got diagnosed. I started having symptoms because we know that's the really dangerous time. That's the really dangerous time. So we just need more time. We can't speed that up. And so just because we didn't hear that the cases in the Netherlands got admitted, or the cases in South Africa have gone admitted to the hospital at any high rate, we may learn in a week that they're getting admitted just like they have for Delta. And I hope that's not true. We have to wait and see. So that's really the biggest reason is enough time hasn't gone by to really see whether it causes severe disease, although we're getting there. And the rest of it is theoretical, and theoretical is wrong sometimes, if not more than sometimes. And so I am watching it closely, and I just want to see the data. That's what you always want to see. You want to see the data. So that is where we are with Omicron today, and I'll keep you posted. So
you said obviously getting the booster is the number one thing we can do. Are there other things we can do to keep from getting exposed to COVID?
Nothing's changed, and I think we've all gotten very comfortable. The question is what else can you do besides getting a booster to guard yourself against Omicron? And the reality is that even if it turns out to be highly likely to be more transmissible, can spread more easily than Delta, which can spread exceedingly easily, nothing changes with how you should approach things. Mask wearing, distancing, hand hygiene. Be careful with your activities. Things like eating in close quarters can spread Delta. It'll spread Omicron too. So it's those kinds of activities that you need to be careful with. Does that mean you're just not doing anything? You're going to lock down for the holidays? No. At this stage, until we know more, the answer is no. The answer is careful, thought out, weighing the risk and benefit with all your activities. If the group is totally vaccinated, it's a very small group maybe you can eat outside. It's those kinds of things that you need to weigh in as you think about how important it is maybe to be in person a little bit for these holidays. For everybody, the decision's a little different, but all I can tell you is I think those preventative measures will continue to work, and you should be very thoughtful in how you plan holiday activities, where you eat with others. Mask wearing, things like that. It will help.
So with vaccines available, why do we still have to do the hand washing? So there are those people out there saying, well, I've had COVID, I've had the vaccine. Sure. Why am I still required to do all of this?
If you've had the vaccine, are you fine now and you can have your normal life and not do things? And unfortunately, we're seeing a lot of breakthrough infections and waning immunity. We expected this. Other countries a little farther ahead with the vaccine, a little farther ahead in the past with their vaccine efforts, also saw this. Israel being a good example. So the answer is everybody probably watching this knows somebody who was vaccinated who got COVID. That's just how it goes. I do, you do, we all do. It's even if Delta stays the predominant variant through this next Omicron phase, somehow, we know that the vaccine's very protective, but not completely. We know there's some level of waning immunity. We know it protects you against severe disease. And we know that at some stages, early in the disease, you still can pass it around, even if vaccinated. Although very, very early, it's been shown definitely, the vaccine has been shown to be effective in preventing significant spread. All that should make you still wash your hands and do basics. If I was asking you to get like some shot or cut off your finger, something really invasive and horrible, then that would not work. Washing your hands, doing other things, basic preventative measures, thinking about where you're eating, who you're seeing. If in the event that there was an exposure, how much contact tracing would you have to do to get back? Are you seeing somebody who's vulnerable, especially if they're unvaccinated? Those kinds of probably frustrating sometimes or exhausting exercises that we still have to do 2 years out, you need to still do because of that. I do get questions when I'm walking the halls in my hospital. I get questions about why is the vaccine not working against Delta or things. Why are we seeing breakthrough infections? Why are we seeing admissions to the hospital for those vaccinated? It's hard to know completely because there's a lot of we know, but there's a number of reasons it's hard to tease out if it's one or the other. One is that as you get very high vaccination rates, that means that anyone who's coming in is going to be vaccinated, right? So it's a probability exercise. If 100% of your community is vaccinated, there's a certain percentage who will still get COVID and a very small percentage who will get sick, especially those that are immunocompromised. So we expect, as vaccination rates to go up, to see a higher proportion of admissions to the hospital, people getting sick who are vaccinated. It doesn't mean the vaccine failed. You have a lot of people vaccinated. And that's what we're seeing. We have a lot of people vaccinated now than we did 4-6 months ago. The other piece that, again, is hard to tease out is there's definitely some waning immunity. There is. Now, the data shows that it wanes against mild disease and moderate disease, but severe disease just drops a little bit over that 6-month period. The answer is the booster. But the reality is that I think some people either just never have a response to the vaccine. Those that are immunocompromised, it's clear they need multiple boosters to really be protected. So there's all these reasons why we would see a vaccinated person get sick from COVID. It's going to happen, and it's going to continue to happen whether Omicron takes over or not. I
want to thank Peggy Acosta. She noted that hand washing is important, whether it's COVID or the flu or any virus.
Peggy, are there other illnesses besides COVID? Right, there's a whole bunch of others. So, Florence Nightingale, everybody, yes, hand hygiene is a very simple way to guard against a number of illnesses, from some of the diarrheal illnesses we see in the hospital, C. diff, to flu, to everything. It's a really effective way to keep yourself healthy, especially during flu season. Thanks, Peggy. Absolutely.
Have there been more advances in treatments? You hear about things like people coming in and getting Regeneron and beating it before it gets hold of you.
Yeah, so that listener is asking about the different types of treatments. Have there been new developments? I will not more than what I talked about at the beginning of this talk, to my knowledge, except with a few caveats. So let's just go over the different classes. The monoclonal antibodies continue to show benefits. So we're seeing the treatments that we did start showing benefit. Sometimes they suddenly not show benefit, and so the monoclonal antibody therapy continues to show benefit. It began as great treatment for those that actually have COVID and are at risk for severe illness. We see it as an option for those at high risk who are just possibly exposed. So as post-exposure prophylaxis, like trying to guard against getting COVID. So monoclonal antibody is still great. We'll probably need some sort of update to it if Omicron takes over, but monoclonal antibodies still great. The treatments we provide in the hospital, the steroids, the remdesivir, still as effective, and we continue to use those. The antiviral pills, orals that are being rolled out, you'll continue to see more and more information about that as it rolls out. And I expect, Merck will, I don't know what the FDA is going to do, but that's really where the new hot area is. The other hot area is providing providing better and better vaccines with easier and easier access. We want ones that don't have to be refrigerated, ones that maybe are nasal, and that way we can get areas in this world that don't have ultra low freezers or have easy access for people to do injections to get vaccinated. I'm going to get on my soapbox and remind you that while there's a coordinated worldwide effort to quickly identify and organize around Omicron, there remains unbelievable inequities around vaccination rates and other resources in a lot of countries. A lot of African countries have vaccination rates in the single digits. And whether, whatever your perspective is and how we should be approaching the world in regards to getting people vaccinated or protecting us against the variant, Omicron, for instance, probably it's hard to know completely, probably did not start in the U.S. My point being is that mutations need reservoirs to develop. And as long as we have countries that are unvaccinated, we will continue to have new mutations. This was completely expected. We'll have another one come at some point. Whether it causes milder illness, that would be wonderful. And that's how the viral evolution, that's how things should happen over time. It may happen over 10 years. It may happen now. It's hard to know. But a reminder that us providing worldwide support for COVID serves our own American citizens, Solano, everybody, and of course it just saves lives around the world, is what we care about.
Right. I read an article recently about home testing kits. Are they pretty accurate or?
Yeah, that question is about home testing kits, which I use at my home and I'm very supportive of. The home testing kits are what we call antigen tests. They are most of them. There are some mail order ones where you can, there's home testing kits where you buy them at Walgreens and you take them home and it gives you results right on the spot. Those are antigen tests that are not the best test. They're not 100% in either direction. You cannot trust one. You cannot trust one if it's positive. In other words, it says you have COVID. You can't trust one even more if it's negative and says you don't have COVID. They work a little better if you have symptoms, and they're much better if you do a bunch of tests. Hence, the Binax Now is one example. They're all very similar, but Binax Now by Abbott comes in a 2-pack if you're buying it from the drugstore. I think it's about $25. And that I like that test. If my kids have some symptoms, I'll do 2 days in a row of tests. Sometimes if it really looks like symptoms, I'll go get them tested in between. They have testing at school, right? There's a whole bunch of different options. Both my kids are fully vaccinated. So I think home test is a nice first option. If you really think you have COVID, you lose sense of smell, taste, although that's becoming less and less of a symptom with these new variants, or a persistent cough, things like that, you should go get a PCR test somewhere in addition to doing some of those home antigen tests. So they're not amazing tests from a accuracy standpoint, but if you have symptoms, they're helpful. If you do serial tests, they're helpful, and I think they're helpful as a first test. They're not the Abbott ID Now, for instance, is a test that clinics use also. So it's not like, these home tests are somehow even less than the antigen tests they're doing, these rapid, quick tests they're doing at the clinic. They sometimes might be the exact same test. And we see that with other tests too. Urine dips, there's some rapid flu tests. Some of those tests, sometimes it's a little better when you go to a clinic. They have a machine and it's a different type of test. It's a little more sensitive. Sometimes it's a completely the same test. So you could, as long as you're reading the directions well, you can do them from home. So I'm supportive of these. I think, get some, put them in your household as we enter this winter season and everybody gets a cold sometimes. It's a good first start to get tested. I am an advocate for testing. Get tested. Find a place you like. It's never going to cost you anything. Other than going to Walgreens and buying the home test. But find a place that's easy to get tested at. And if you feel something, go get tested. It's a swab in your nose. Sometimes it's a saliva test. It's helpful to know. You will slow the spread less if you get tested. I know many people that just get tested once a week. It just makes them feel better. It makes them feel like as I go through life and I'm kind of doing experience. I'm having a very carefully planned activities here and there. That just every week I'm making sure that I'm keeping myself and others safe.
Will it give you a positive test if you've had COVID in the past, or is it testing
the question
for
is,
something else?
will home tests? I think that question is. I don't know if it's a bigger discussion. If the question is, does any test turn positive if you've had COVID? And some stay positive for quite a while. The home rapid Abbott ID Now rapid test. There's a few other companies. Those antigen tests don't stay positive very long. If you're actively symptomatic, it will stay positive. But if you're weeks out, it's unlikely to be positive anymore. So no, it should turn negative over time.
All right. We have boosters available for kids age 5 and up now.
My kid got it.
Kids tend not to get as sick as adults, so why is the vaccine important for them?
The question is kids don't get as sick as adults. Why is it important for them to get the vaccine series? It is a risk-benefit discussion. There are very few, tiny adverse effects from that booster. We're now, right? We are pretty far out now from that vaccine going live, and it continues to show benefit and minimal risk. So while kids are very low risk to getting hospitalized because of how widespread this virus is, children's hospitals were filling up, which is scary. A sick kid is scary. So first and foremost is, yes, low chance of your child getting hospitalized, but not zero, and hard to predict who gets sick from it. So that's reason number one. Low risk vaccine, you're right, kind of low risk your child getting hospitalized for COVID, but the benefit still outweighs the risk of getting the vaccine. Number one. Number two is there's still a lot to be known about the long hauler symptoms. Even people with mild symptoms are having long hauler type effects. Probably hard to test for and see in children. And so, do you want your kid foggy for months on end, having kind of breathing problems, having problems in school? Just ain't worth it. And it's one of those things that is tough to know. That's an Omicron issue too. If we see in the next few weeks as we get more data on the symptoms of Omicron, that it does cause milder disease, we're still not going to know for months and months and months whether it causes some of those long hauler symptoms. Another reason to get your kid vaccinated. Lastly, and probably the most obvious, is grandma and grandpa love to see their grandkids. And remember, that's the group where many are immunocompromised, whether they are medication that causes that, whether they have diabetes, whether they didn't. They are still, even fully vaccinated, a higher risk for getting hospitalized. Man, you don't want your kid getting COVID, maybe not even knowing it, and giving it to grandma, grandpa, whoever. So those are all the reasons to get your kid vaccinated.
Are we seeing any surge yet? I know there was some concern as we enter the holiday season.
Yeah, questions about where our rates are. Kind of going back to the initial discussion. Good question though. At this stage, we're not. California is seeing spikes of cases in certain areas, and the U.S. There's a few states really driving the 100,000 cases a day that we're seeing in the U.S. Right here in our own Solano County, right now, we are not seeing a big spike of cases. We're just seeing a little trend upwards. None of it is overwhelming the hospital resources. That's what I care about most. If I wasn't a healthcare leader, that's also what I would care about. I'll go back to early in the pandemic. Our epidemiologists, our public health experts would say, really honestly, the chance of us containing this is low. We got to try to flatten the epidemic curve, spread out exposure so that our hospitals don't get overwhelmed, because that's what saves lives, is that we have resources to take care of the sickest. And that's fine right now. We have, as you heard from the beginning, across the county, we are seeing hospitalizations in the 20s over the three big health systems. And so that's very little compared to the over 100 that we were seeing during some of our spikes of cases. So we're doing okay this week, but no crystal ball on that one. We'll have to see what happens.
All right, well, we're about out of time.
Wow, that went by quickly.
It did. I want to remind the viewers that you want to join us again tonight at 6 o'clock when our genetic counselor, Karen Vikstrom, will be talking about your genetics and what it can tell you about your health.
Karen is wonderful. Do not miss that talk. She's really great. And I'm going to be doing this monthly right now. And when is my next session?
It's in January, but I don't know if we've picked the exact date yet.
I will see you. We'll post it, and we'll see you in January. Have a wonderful holiday, and I'll see you in 2022.
All right. Thank you.